Hey, welcome back to Not So Complicated, and today we'll be talking about side effects of amlodipine. And if you are a hypertensive patient and on amlodipine from a long time, you might be overlooking these side effects, serious side effects, right? So let's begin. How does amlodipine actually works? Is that it blocks L-type calcium channels in the blood vessels, right? So that will lead to decrease in vascular smooth muscle contraction causing vasodilatation. So what is actually happening is that there is decrease in total peripheral resistance leading to blood pressure falling down, right? So if that falls down severely, you can experience severe hypertension. So that is our first side effects, and that manifests is 4 different symptoms or signs. You can feel dizziness, or you can have an experience of syncope or fainting. You can also feel fatigue, and the other side effect is blurred vision, right? So since there is severe hypertension happening, there is a compensatory mechanism in our body to increase that blood pressure, right? So what actually happens is that the sudden vasodilatation leads to decrease in blood pressure, but that will stimulate baroreceptor reflex, finally causing increase in sympathetic activity, and that manifests as reflex tachycardia, that is increase in heartbeat, right? So rate of heartbeat, so that manifests as 4 different signs again. The first one is rapid heartbeat, and you can also feel palpitations, that is you get aware of your one heartbeat, right? So and you can also experience chest pain or chest discomfort and also anxiety, right? So these are like the other side effects of the amlodipine. And since we all know that there is vasodilatation happening, what actually happens is precapillary arteriolar dilatation is more than postcapillary venous dilatation, and that will lead to increase in hydrostatic pressure in the capillaries, and that will lead to fluid leakage in the interstitial space, and that manifests as peripheral edema. Edema can happen anywhere. The first symptom you can experience is in ankle or leg edema, right? Ankle or leg swelling, that is tight shoes, you can see in the image right there, and puffy skin again, and then no significant weight gain actually happens from the edema, right? So but edema is mild, so there is no significant weight gain by the edema. So you can also experience rare idiosyncratic liver reaction to amlodipine metabolism, that is due to hepatocellular or cholestatic injury, and that is manifested as hepatotoxicity. So there are a lot of functions of liver, right? So there are a lot of manifestations of hepatotoxicity. Out of them, the first one is right upper quadrant pain, because the location of liver is right upper quadrant. And also you can experience jaundice, that is alloys mucous membranes, you can see in the image right there. And also dark urine or pale stools you can experience. You can experience, like in laboratory values, there are elevated liver enzymes like AST and ALT, right? So the other side effect is there is increased fibroblast activity in the gingiva, that is gums, and due to that is due to calcium channel inhibition, right? So that will lead to increase in collagen production and causing gingival hyperplasia. So you can see in the image right here, there are swollen gums, right? And there will be bleeding while brushing. So you have to be cautious about that, and you also experience difficulty in chewing. And if you have poor oral hygiene, then it will worsen this gingival hyperplasia and the symptoms manifested by that, right? So these are the serious side effects that you have to be considerate about, right? So that is all for today. Subscribe for more clinical pulse, and thank you for staying with me.